The disadvantages of sleeping too much. The body needs to get enough sleep and rest daily, but excessive sleep may have adverse effects on health. The disadvantages of sleeping too much. Oversleeping may increase the chances of developing a range of complications and health problems, such as 1. Cardiovascular disease. Sleeping too much can negatively affect the health of the circulatory system, and it has been shown that women getting 9 to 11 hours of sleep at night may increase the chances of developing coronary heart disease. It has also been shown that sleeping too much or too little sleep may increase the chances of heart attacks, but the link between too much sleep and cardiovascular disease is still not completely clear. 2. Various psychological disorders. One of the harms of sleeping too much is that it may cause a range of different psychological disorders. Here is a list of the most important ones. Depression. However, it should be noted that the link between depression and excessive sleep is still a matter of controversy. While some experts believe that excessive sleep may cause depression, others believe that excessive sleep is what causes depression, not the other way around. Anxiety. Sleeping a lot or lack of sleep may cause increased anxiety in some people, which may negatively affect various aspects of their lives, and chronic insomnia may increase the chances of developing anxiety. Problems with comprehension and concentration. Sleeping too much can accelerate brain aging and reduce the ability to perform some tasks with usual efficiency, even simple tasks. Other mental disorders. It may push a person to some unhealthy or even dangerous practices, such as suicide attempt, illegal drug use, or some types of medication. 3. Headache and back pain. Sleeping a lot can stimulate different feelings of pain in the body or increase the severity of the pain already present in the patient. For example, sleeping too much may cause things such as increasing the severity of headache pain in people who are prone to headaches, as excessive sleep may cause an imbalance in the neurotransmitters in the brain. Feeling of pain in general in the body and pain of increasing intensity in the back among people who suffer from back pain in particular. 4. Sleep damage. The damages of sleeping too much do not stop at what was mentioned above, but too much sleep may have many other damages that are still being researched and studied, such as obesity, as some studies have shown that sleeping for between 9 to 10 hours a day may increase the chances of obesity. Diabetes, as it was found that sleeping a lot may increase the chances of developing type 2 diabetes. Death, as it was found that people who sleep more than 9 hours a night and regularly have a higher chance of death compared to people who get 7 to 8 hours of sleep a night, and too much sleep may increase the chances of death in people with some diseases. Reasons to sleep a lot. Oversleeping may not be just a type of transient laziness, but there are many things that may cause sleeping too much. Here is a list of the most important ones. 1. Narcolepsy. Narcolepsy is a neurological disorder that arises when the brain suffers from a defect that prevents it from controlling the sleep-wake cycle, which may lead the patient to fall asleep without warning anytime and anywhere. 2. Depression. Depression is one of the most common causes of hypersomnia. A depressed person feels low energy levels and tired most of the time, which can cause him to sleep for longer periods than usual. 3. Incidence of sleep interruption. This disease causes the patient's breath to be interrupted for a short period during sleep, which may lead to him waking up repeatedly at night and interrupting the usual sleep cycle, which may increase the body's need to sleep for longer hours during the day and night. 4. Hypersomnia. It is a term usually given to the condition in which a person's desire to sleep for longer hours during the day increases, and it is a desire that does not decrease and is not satisfied even when taking a long or short daytime nap. Oversleeping may cause a range of health complications, such as anxiety and memory problems. This is the recommended number of hours of sleep, depending on age. Babies up to 3 months old, 14 to 17 hours of sleep per day. Babies aged 4 to 11 months, 12 to 15 hours of sleep per day. Children aged 1 to 2 years, 11 to 14 hours of sleep per day. Children aged 6 to 13 years, 9 to 11 hours of sleep per day. Adolescents aged 14 to 17, 8 to 10 hours per day. Adults aged 18 to 64 years, 7 to 9 hours per day. Seniors over 65 years of age, 7 to 8 hours per day.